Hi everyone, I'm Dr. Padmavathy. I'm a consultant pulmonologist at Mitra Hospital, Calicut. The COVID pandemic took us all by surprise, but the first wave was tackled effectively with a widespread nationwide lockdown. The second wave came rather unexpectedly and hit us hard. So many people got infected, so many suffered in ICUs, and many lost their loved ones during the second wave. But despite that, a lot of people were infected, were asymptomatic, did not test, or passed off their symptoms in home quarantine. Now, the question arises whether a third wave of this pandemic will hit us soon. Or think again, perhaps it's already started. We see daily rise of TPR numbers, daily high number of cases being reported, and little spikes being reported nationwide in various cities and towns. In such a situation, what should we be doing? There are many people who predict that perhaps the next wave is going to hit children hard. We don't know. But what should we do? What should be done is that we maintain all our precautions just the same way that we did during the first and the second waves. Make sure you invest in a good quality face mask and you wear it at all times when you step out from your homes or are in contact with a possibly infected person. Ensure you maintain hand hygiene. Whenever you commonly touch surfaces such as tables, doorknobs, lift buttons, other handles and doorknobs, you always sanitize your hand with a good quality hand sanitizer or wash your hands with soap and water thoroughly for 20 seconds. Now that the government is declaring opening up of various establishments, institutes, shops and various commercial places, there will be a lot of people flocking these areas trying to get their needs. Make sure that you go during a non-peak hour when there won't be crowds. Make sure that you wear your mask and ensure physical distancing of at least 1 to 2 meters. If you see that someone else is not wearing their mask or is having symptoms of cough or cold, make sure you maintain your distance. These are the various small things that we can do to ensure our continued safety during this pandemic. The other important thing is that if you are a person who has a chronic lung disease such as asthma, bronchitis, COPD, bronchiectasis or any lung disease, ensure that you continue taking your tablets, your inhaled medications or your nebulizers. If you are due for your next checkup with your pulmonologist, do not skip it. Make sure you get an appointment and reach there on time and avoid crowds. Once you finish with your appointment, ensure that you get your adequate stock of medicines before you go home so that you do not have to venture out time and again to the hospital. These are the various small precautions that you can take to prevent yourself from getting infected. The other most important factor is vaccination. Vaccination is perhaps the only way we can ensure that we do not develop severe infection. Vaccination does not prevent you from getting COVID, so just because you got vaccinated does not mean that you can stop wearing a mask or stop taking all the precautions that I mentioned now. If you have already been infected with COVID, you can get yourself vaccinated after a 3-month time gap. Which COVID vaccine? It doesn't matter. All the vaccines are equally good, and as long as you can get vaccinated, it's important that you get it done right away. These are the things that we can do to ensure our safety and lung health during the third COVID wave pandemic. Take care and stay safe. Thank you.